Hello, this is Homa Haydari and welcome to this digital presentation about promoting nutrition in babies, toddlers, and preschoolers. Throughout this presentation, the role of nutrition in children's development, as well as feeding infants, feeding relationship, infant formula, complementary food, feeding toddlers, food safety, menu planning, and feeding preschoolers will be widely discussed. A list of resources which had been used to gather this information will be presented at the end of this video. To promote nutrition in babies, toddlers, and preschoolers, it is essential to understand the importance of the role of a healthy nutrition in children's development. Adequate nutrition is one of the significant elements affecting children's growth and immunity. Childhood is the most important period in establishing nutritious eating habits to improve physical and also mental abilities. So, it is necessary to determine children's dietary requirements, assisting them with growth and development. Proper nutrition leads to overall growth and development, which brings a healthier life to children. Children have their own special nutrient demands, and meeting these needs is essential for a child to grow. In order to provide children with a diet containing their nutrients demands and requirements, it should be clear that what is meant by nutrients. Nutrients are substances in the food that bodies undertake in order to enable it to function. Nutrients can be divided into macronutrients and micronutrients. Macro means large, so micronutrients are needed in large amounts in our body. Micro means a small. Micronutrients are required in a small amount in our body, and they include vitamins and minerals, as well as calcium, iron, and vitamin C. Macronutrients also contain carbohydrates and protein and fats, which are all vital to children's physical and mental growth and development. Children's nutritional status begins with mother's nutritional situations during pregnancy. It is important for expectant mother to achieve necessary micronutrients and get enough rest. During pregnancy, nutrition plays an important role in both mothers and subsequently children's health and growth development. Poor nutrition in pregnancy can lead to growth retardation, delayed psychosocial development, cognitive and behavioral problems, increased risk of psychiatric disease. Here we can see a fetal growth in different weeks during pregnancy. In fetal growth period, most of the children's organs, blood, brain, and bones are formed. That is when any lack of maternal nutrition can result in irremediable harm. The second part of the presentation is allocated to feeding infants. That is where breastfeeding and infant. 1 infant. 2 infant. 3 infant. 4 infant. 5 infant. 6 infant. 7 infant. 8 infant. 9 infant. 10 infant. 11 infant. 12 infant. 13 infant. 14 infant. 15 infant. 16 infant. 17 infant. 18 infant. 19 infant. 20 infant. 21 infant. 22 infant. 23 infant. 24 infant. 25 infant. 26 infant. 27 infant. 28 infant. 29 infant. 30 infant. 31 infant. 32 infant. 33 infant. 34 infant. 35 infant. 36 infant. 37 infant. 38 infant. 39 infant. 40 infant. 41 infant. 42 infant. 43 infant. 44 infant. 45 infant. 46 infant. 47 infant. 48 infant. 49 infant. 50 infant. 51 infant. 52 infant. 53 infant. 54 infant. 55 infant. 56 infant. 57 infant. 58 infant. 59 infant. 60 infant. 61 infant. 62 infant. 63 infant. 64 Breastfeeding is an effective eating habit to maintain babies' health. It provides the best nutrition for infants, including different kinds of vitamins, fat, and all the nutrients that your baby needs to grow. It can also be digested more easily than infant formula. It helps your baby fight with different viruses and bacteria and protects them from infection and some different kind of disease that infants could be at risk of contracting. Infants who are breastfeeded for the first 6 months will get less ears infections. Breast milk also has some positive effects on cognitive development and IQ scores in later years. Breastfeeded infants also get the right amount of weight based on their age group. As infants grow at a rapid rate, they require more nutritional needs than toddlers and preschoolers. It is recommended that infants continuously be breastfed until the time solid food are introduced to their diets, approximately at 6 months old, and it better be continued until 12 months. When it comes to breastfeeding, the feeding relationship which is established between infants and parents or caregivers during milk feeding is so important to be mentioned. This close relationship also accelerates children's growth and development. It can happen in a very relaxing environment, enjoying being and interacting with the infant, having eye contact with them, trying to distinguish their signs indicating their different needs in order to respond to their needs and make a deeper relationship. So, it is essential for early childhood teachers to have a very wide knowledge about the advantages of breastfeeding in order to encourage parents to breastfeed their children at least until 12 months. As babies grow, their need to be fed decreases from 12 times a day to 4 times a day. That happens at 12 months old. Here is a video explaining how to get a skin-to-skin touch with your baby, latching babies on the breast to build the breastfeeding relationship.
The key to a successful breastfeeding relationship is comfort, both yours and your baby's. The first step is making sure that your child has a correct latch or attachment onto your breast. Improper latch-on will prevent your baby from feeding properly, and it can damage your nipple tissue and hurt. To help your baby latch properly, your baby should always face your nipple. His ear.
There are some points which are good to know in establishing natural breastfeeding pattern, such as allowing infants feed as many times as they want, offering babies both breasts each time, and letting the infants finish the first breast and then offering the second. Infant formula. Although breastfeeding is the best way of feeding babies, infant formula also has its benefits. Essential nutrition can also be provided through infant formula. Parents choose to feed their babies with infant's formula due to different reasons. However, early childhood services and teachers should always respect parents' choice of feeding their children and support them in either way. The fact that a formula fed infant can be fed by anyone at any time is one of this method's benefits, and that helps also fathers to create a close relationship with their babies while they are feeding their infants. While mothers who breastfeed their children should pay attention to their diets because of different substances that happen during this time, mothers who feed their children with infant formula can eat and drink anything they desire. They also can take any medications they need to. There are some disadvantages of this method. Although infant formula contain different vitamins and fat for children development, it could never completely match the composition because breast milk is slightly different from one mother to next to meet the individualized needs of each baby. Digesting formula is usually more difficult for children because of the ingredients used to make these formulas. Complementary food. When breastfeed alone is no longer sufficient for baby's growth and development, complementary food are introduced to their diets. Complementary food is any food or liquid which are given to children to complete their nutritional needs and requirements. During this transmission, breastfeeding may also be continued. This usually happens at 6 to 12 months old. In this while, breastfeeding is continued to be the main source of protein and other nutrients. However, other food, especially food containing iron, will be added to baby's diet in order to make them ready for consuming and digesting solid food in later years. As infants' iron store begins to decline at 6 months of age, beans, beef, chicken, fish, and eggs should be placed in their diets in order to redress the balance. Here is an example of a simple recipe for iron-rich food for babies, which is a chicken soup. The table shows daily iron needs for babies and kids at different age groups. Feeding toddlers. By the time infants turn to toddlers' age, new food will be introduced to their diets. That is because their physical, mental, and cognitive developments will improve a lot at the age of 1. Toddlers become able to choose their food and feed themselves. At this age, children learn to eat more solid food and will try different tastes. Their range of food choices will increase at this time since they get to know their food preferences. So it would be the time parents may have difficulties feeding their toddlers healthy and nutritious food. It should be considered that toddlers are at the age group which need to get different vitamins, proteins, carbohydrates, and their need of nutritious food stand high. This is why their desire to eat served food mostly reduces. In order to provide a healthy and nutritious dietary habits for toddlers, parents and early childhood teachers can involve them in food preparation and family mealtime. Food safety and menu planning should also be considered at this time to provide a nutritious diet for toddlers. Food safety. There are some situations in which food can become a source of illness. As children's immune system are not fully developed until the age of 5, they are at a high risk of getting foodborne illnesses. Parents and early childhood teachers should understand how food could become contaminated and apply some strategies to keep children's food healthy and safe. There are some food healthy programs helping parents and also early childhood settings to maintain a safe and healthy environment to serve food for children. Good hygiene, like washing hands and truly dyed them, cleaning the area in which food will be prepared, and also teaching children how to wash their hands properly before eating food and after touching kitchen areas or some food like raw meats can be one of those programs. Sterilizing is another way of approaching food safety. All equipment, including bottles or cups used to feed the baby, must be sterilized before use. Don't keep any food in the fridge for more than about 3 days. Equipment can also be sterilized by boiling in water for 5 minutes. Storing food is also so important to make the food healthy. The expiry date should be paid attention to in storing. The food which will be expired sooner than the other should be stored at the last ones. Menu planning for all children at different age groups is one of the effective methods to organize food resources and maintain healthy and nutritious diets for children. In order to achieve all the nutritious goals needed to provide a healthy and safe environment for children and help them to develop more effectively, planning a menu based on children's nutritious needs is very important. This menu should contain healthy and cost-effective ingredients and recipes, and should provide proper amount essential food according to the dietary regulations. Parents and early childhood teachers should also understand the needs as well as likes and dislikes of children about different foods, and they can further plan to provide substitute food. In this way, a healthy lifestyle can also be practiced at early ages, which may last for a lifelong. Feeding preschoolers. Eating habits are still being developed during preschoolers' years, 3 to 5 years old, so they need to be encouraged to eat healthy food. As they are still learning how to trim their meals, they need attention during mealtime. Children at this age group become very active, so the amount of fat in their bodies will decrease due to their long activities. This is why their bodies need to gain nutritious substances stay high. So the main goal in this period of children's growth is to create and keep balance between children's requirement of calories and energy spending. So their daily diet should contain a rich mix in taste, colors, and textures. Children at this age group can mostly eat what adults usually have, but it is better to put cereals, seafood, and whole wheat bread in their daily diets. As children grow up, they become familiar with different kinds of food which does not have any nutritious value. It is parents and early childhood teachers' responsibilities to prevent preschoolers from consuming this kind of food. This is the end of this digital presentation. We hope to find this information useful at raising and feeding children. Here are the references used to gain this information. Thank you.